Hi everyone, good morning. Good morning, good morning. Today we're going to talk about Chinese medicine for amenorrhea treatment. It means that we use Chinese medicine to treat female whose menstruation stopped for a while. Right? Supposed to come once monthly, happen monthly, and actually stop. The reason I do this is because I want to do the live video topic every day. The live video topic is same as Chinese, the, the content's the same. So I added on one more for English today and tomorrow as well, because we do it in the morning, 7 o'clock in the morning, but today is a bit late. Then at night time, about 8 o'clock in this time in New Zealand, and I actually do in Chinese. But tonight we're gonna have a acupuncture and Chinese medicine to treat migraine case study in Chinese. And tomorrow night will be in English. Right? So I will miss a Chinese live video because it's my promise and to everyone that I'm going to do a case study every month on a different topic. So it's me in the morning. If I keep going with the fertility one, and my Chinese live video will be high, so I try to do extra topic for English today and tomorrow morning. Good morning, Veronica. Thank you for joining me. Thank you. All right, so let's start. Today we're going to talk about a case for a woman who suffer from Amenorrhea. I'm not very good to pronounce this. It means that the period stopped for a few months. Okay, I recently have a case as a student. So in this case, we're going to learn how important the blood is. And we're going to talk about if infertility case, a lot of cases actually related to the blood. Now we talk about previously, female rely on the blood, right? Female, we say 先天 pre-heaven, right? And 后天 post-heaven. In Chinese medicines, we say, well, the kidney is pre-heaven organs. The stomach and spleen, post-heaven kidney, post-heaven organs. The reason we say that is because, according to Chinese medicines, pre-heaven means the constitutions of a human body is actually relied on both your parents, mother and father, giving it to you. They call pre-heaven. Before you form a life, it's from the sperm and eggs and become embryo, then a baby develop. Okay, so the stuff, the very original stuff, things, gene, DNA that you form the parents, you didn't develop yourself. Okay, develop from someone else and came to you. Okay, this is the idea. That's what we call pre-heaven, and that's actually the kidneys. Kidney is water, and water start the first according to Chinese medicines. Okay, so water. If there's no water, nothing else. So it's just water, and from kidney and then everything. Right. Then when pregnancy, go through pregnancy and then give birth, and after give birth, you rely on the nutrient eating to grow, right? You get nutrition from food. So who break down those food into blood? Stomach and spleen. Stomach and spleen. Okay. So stomach and spleen absorb those food, turn into nutrient into the blood. So stomach and spleen keep you going until the day that you die, right? So that's why we call stomach and spleen post-heaven organs. So there are two different things in here. The pre-heaven things, pre-heaven organs, you can just manage it. You can't get extra more things for it. Okay, but so pre-heaven organs and post-heaven organs, we call 先天 and 后天. It's very important. So both of them are equally important. Okay. Now, when we talk about this, then when it comes to female infertility and male infertility, there are different sayings now. Well, not just now. It's just when it comes to infertility, the male, is still using the same theory. Pre-heaven organs, kidneys. Post-heaven organs, stomach and spleen. But when it comes to infertility, the female one, say pre-heaven organ is actually liver. Post-heaven organs, stomach and spleen. So there's different. The reason is that is because when it comes to infertility, we are talking about period, regulating the period. Now, period is a sign that lets us know whether you can still conceive or not. Okay, if you haven't got a period, I'm sorry. Menopause mean you may not release the egg. The egg quality may not be there, and the hormone is not there. Therefore, if there is period, menstruation Monday, then we can track how your ovulation, and there is still chance to improve your fertility rate. Does it make sense? So menstruation, we talk about bleeding. So in woman, you lost blood every month. Or the other idea for you is you're not losing blood. You actually clean your body every month. You pass out the things that you don't need to. Think about this is a detoxing issue. Detoxing function, not issue. Function. Okay. So people think, oh, I hate period, I hate bleeding. Think about it. It's a way to detox. Bring the bad thing out of the body. Okay? So this is something different. Now I want to mention in here, you may feel that doesn't make sense for you. But according to Chinese medicine, women get menstruations, we call 月经 monthly bleeding, right? 月经. And do you know what? the men get 日经, which means daily menstruations. Well, that's gonna put you a big question for you. Well, how could men get 日经? A man shave daily, you see. We had to shave this daily. Every day. We don't do it a month. We do it daily. This is our daily menstruation for men. Right? Why is that? 发为血之瘀. The here are the extra stuff from the blood, according to Chinese medicine. Well, if you're an acupuncturist, you know. Now, first you need to accept that Chinese, if you're a patient, Chinese medicine and Western medicine are totally two different systems. If you keep thinking about Western medicine, hey, you won't understand this. Okay, but it makes sense to us. The first theory in there is any hair, any hair in the body here, body hairs are the extra things of your blood. It comes from the blood. The blood turns to the hair, right? So what it means is the menstruation is the lining falling off and become blood, and the lining is built from the blood as well. So every month, women lose blood, it become period, menstruation, and men actually lose the hair over here. It grows here, and you have to shave it, and the hair actually from the blood. So we call the men get 日经 and the woman get 月经, monthly menstruation. Men get daily menstruation. So this is according to Chinese medicine, right? When you have the theory of hairs from the blood, then that makes sense. Does it make sense to you? If you're an acupuncturist, does it make sense to you? I didn't make it up. It's from 黄帝内经, but a lot of people didn't know that. I didn't know it until my master told me that. I said, oh, okay, that makes sense now. That makes sense now. Now, pretty easy, isn't it? Pretty easy, okay. This is a way to actually get bad thing out of the body, right? Passing out, right? So, in reality, that the female are more focused on the blood, okay? Female relying on the blood. If men relying on blood as well, of course, but female, because they lose blood, you can see it monthly, there's a lot coming out, so they need the blood. And another reason is when the implantation in the uterus, they're relying on the lining, so it's about 8 or 9 mm. Anything less than that, 6-4, means that you haven't got enough blood to bring the lining thicker. So that is not going to happen with infertility, with pregnancy, conceive. Okay. So always, when it comes to female infertility, blood is the number one thing. Okay. It can be endometriosis is diagnosed. It can be fibroid, especially fibroid, losing blood. Then the iron will be low and the blood will be low. And it can be thyroid issues. It can be hormone issues. It can be diarrhea. It can be PCOS, not release its ovulation properly, miss your ovulation, miss your period. Okay, so any of this, or it can be light bleeding all the time. Okay, it can be unknown reason of infertility. Okay, it can be all this. I want to tell you this: when it comes to unknown or whatever, the fertility specialist give the diagnosis, whatever the report, the reason that the patient tell you that, okay, you need to check the blood according to Chinese medicine. Okay, this is important, number one important. Well, and the Leo will arrive, and people will say, well, the cash flow is the king. I say that the blood circulation is the king when it comes to fertility. Or you can say the blood flow, the blood circulation is the queen. Up to you. Okay, it means that it's very important in the blood flow, in the blood quality, the amount of the blood. Okay, so how do we know? First thing first, doesn't matter what conditions, you want the patient must take a blood test of iron and ferritin. For example, if the ferritin is 20 to 180, 20 to 180, that is the normal. Now, the patient may tell you that my iron and ferritin is normal, and you want to keep asking, what is the numbers, the reading? Because 20 to 190, 20 is normal, 21 is normal, 22 is normal, 23 is normal, 30 is normal, 40 is normal, and up to 190 is normal too. So in between 20 to 190, which one are you at? What level? Now I want to tell you something, because for the Western fertility expert, they will look at it 20, 21, 23, or 30. Your fertility's normal. But I want to tell you, some patients, they can get pregnant no problem. Okay, if you're not in a fertility treatment, you don't have to worry about it. If you still have your energy, and that's okay. If you run out of energy easily, you feel tired easily, and you get lack of not enough bleeding, or you can't get pregnant, you've been trying and trying, you just can't get conceived, then 30, 23, 25, or even 20 or 40, 20 to 190, right? You are normal in the lower end. You want to increase your ferritin to 90 or 100 in the higher end of normal standard. Does that make sense? And infertility, doesn't matter what the real cause is there. Okay, then if the ferritin or iron is low, in Chinese medicine, you always want to make sure the iron is the normal on the upper end or in the middle, at least in the middle, not in the lower end. Okay, that's why I say we have a different standard in Chinese medicine according to TCM versus WHO standard when it comes to sperm as well. Okay, let me show you a case. Okay, this is the case that recently it came to me, but it's not a fertility case. This student, 22 or 23, okay, very young student, over the lockdown time. Before the lockdown, she experienced no period, and it got worse over the lockdown time. So when she came to see me, that is 3 months, no period. Of course, you worry about the first thing you need to think about is the pregnancy. So run the pregnancy test, negative. Go to a doctor, run some blood report, and run that pregnancy test according to the blood, negative. Okay. So as a practitioner, we always ask, this is important. No period, is it pregnant? Right? If their boyfriend, blah, 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 you need to check, is it pregnant? So the patient will say, no, I won't be pregnant, blah, blah, blah. Don't trust it. I said, when did you get the pregnancy test? Write it down when, and noted that as a practitioner, we noted not pregnancy test negative on blah, 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 according to patient. If it's just done one, I think do another one, at least two. Okay, it can be 3. So this patient suffer from anxiety, very worried. The reason she suffered from anxiety is that it happened once that the cockroach crawl on the pillow. Nighttime she sleep and she get, what's going on? And then look at the cockroach and very frightened on the cockroach. Okay, so it was very, very scary for her. And ever since, anxiety happened over a lockdown time, and she wanted to keep everything clean. If there is a little bit of sound, she may think, it's a cockroach. The whole house. I think they live in the unit, a student with boyfriend. So with this anxiety, that actually make her have a thought of suicide. So that is, and I quickly asked her, are you on any medication? Do you ever have any kind of things that happen to you? And there is none. The boyfriend said, no, there is nothing, and never had depression or things like that. And you wanted, I want to note that people on the antidepressant, they may have a thought of suicide. So you want to know this, okay? Because you want to prevent that. If there's a side effect of the drugs, she's not on it. Another thing is, she's from China, and she had a what I call is a bad habit, that going to bed very late, 12 o'clock, 1 o'clock. Since the anxiety happened and she couldn't go to bed because she keeps thinking about cockroach everywhere, and then she sometimes get into 6 o'clock or 5 o'clock in the morning and go to bed. Right? That was lockdown time. And when the schools, the university start, and she came to me, and another thing is cold, very cold. Hands and feet are very cold. And she did foot bath, and nothing helped. Quickly the coldness come back. So in this case, I asked her, have you done any of the tests yet? She said, yes, everything's normal. I said, let me see the reading in the first treatment. So now She didn't bring it. I said, that's okay, but next time you must bring it to me. Let me see all the reading, all the tests. Okay, I must see all the tests. Otherwise, because it's going to be simple, because when I take pulse and I look at it, I don't know about the iron. Okay, I want to see what test has been done. As a patient, they don't know, because the GP ordered all the tests for her and everything's normal according to the GP, and you can read it, everything's normal and it's fine. So I took the pulse, I give her the herbs for a week. Now the pulse said the stomach is, liver and gallbladder out of balance the most. So what is out of balance? So this is an idea. I always talk to my patient this. If this is one organ, doesn't matter what organ is it, okay, this is another organ. So the organ work together, they need to be balanced. What is balance? On this label, this is balance. If this is imbalance, right? How about this? That's imbalance, right? So this is balance. So if that is that way, that's imbalance. That's imbalance, right? This is balance. But if that is in here, we need to reduce this, lower, improve this, bring it up a little bit. So that's balance. So what we call reduce technique and tonify technique, right? If this is liver, this is gallbladder, reduce liver, tonify gallbladder, right? Now, if this is liver, between liver and gallbladder, right? Because they have barely relationship. What's internal, what's external, right? What about is this? If this represents liver and gallbladder, wood, and this represents stomach and spleen, earth. Stomach and spleen need to be normal, because according to the pulse, they're both guan, right? On that side there is wood, on that side there's earth. Earth and wood need to be balanced, right? If they are not balanced, if this is liver, well, this liver and this is wood, which is liver and gallbladder, this is stomach and spleen, earth. So you need to tonify, bring the stomach and the earth, stomach and spleen up, reduce the wood, liver and gallbladder down, and become normal, balance. But what about go opposite? Go opposite, yeah. So it's funny, if an acupuncturist, we have an idea, always have an idea that the wood against the earth, but this is about yin yang. In reality, yes, the wood against earth, and the earth, if the earth are too strong, the wood gonna go down. So we do the opposite. How do we do the opposite? We tonify the wood, reduce the earth. But this theory, no one will tell you that, because it seems like against your theory, your knowledge, right? We always talk about the wood too strong and the earth lower. But in reality, in the pulse, you can find liver is going down and the earth is going up, and you're actually doing the opposite. So our method treat patients are very different. When I say very different, it's not because we create something different, something new. This is according to Huang Di Neijing. It's the real Chinese medicine in a classic book. So this patient, when she came, the post said that it's a liver and gallbladder too strong. Okay, so I give her herbs, reduce liver and gallbladder function a bit, and reduce kidney and bladder function a bit, then tonify heart and small intestine. Oh, hang on, it's a more routine. Sorry, my bad. I should say reduce wood and fire, which means reduce. This is iron principle. Reduce the liver and gallbladder function. Reduce because they're working too hard, and reduce the heart and small intestine function, and tonify the metal, which is large intestine and lung. Tonify them. Okay. So that is the treatment. So liver, gallbladder, 2 herbs, heart and small intestine, 2 herbs, reduce those. Use 4 herbs to reduce 4 organs. And 2 herbs in here, which is lung and large intestine. 2 different herbs for this, and to improve the function. When this improves, those 4 will go down even further. So that's the principle. The principle is there, so I give the herbs, and no acupuncture for this case. So the first week, the patient came back the first week, and she showed me the report. And after 3 or 4 days of herbs, and she actually texted me. She said, "Well, I have ulcers, very painful in the mouth." He said, "Is it causing from the herbs?" And she didn't say nothing. And I said, "Let me check the herbs again," because I forgot exactly what I prescribed to her. There's too many patients, right? I checked the herbs and said, "Oh, ulcers? I've got Huang Nian in it." The herbs of Huang Nian. Huang Nian is very good for ulcers. I said, "Okay, it doesn't make sense to get ulcers." I said, "Don't worry, because this herb still suitable for you. Keep taking it, and keep an eye on the ulcers, the painful ulcers in the mouth. And we'll see in a few days," because she came weekly, right? So she took the herbs, finished the herbs, and came back Saturday. Then I asked her, "How's the ulcers?" "Oh, went away, 24 hours. And then I keep asking, "So how's everything? No period yet?" No period yet." "Okay, that's okay, because it takes time. We plan for a month." Then I said, "How's everything else?" "Oh, much better. I could sleep now. And much less anxiety." She used to sleep to worry about the cockroaches, and she couldn't sleep. And now she can sleep before 12 o'clock. She said, "I can feel that I'm getting tired, and I go to bed. I actually sleep. I'm not those sound. I didn't hear any sound. I just sleep very deeply." You see, that's the difference. Then she said, much less anxiety, which has helped a lot. Sleeping, good. And she said, "Wow, I got very warm now. Before the herbs, I was very cold in the foot and feet and hands. She did foot bath, and quickly the cold coming back again. Now, she didn't need any foot bath every night. No foot bath. And warm. We are in winter. And she can go to sleep, no problem." You see, this is the herb that generate the organs function and become warmer. Warmer means circulation is better. Okay, I think that's good. Let's take the pulse. When I take the pulse, oh, better. But the pulse still presents the same. I say keep taking the same herb, no change of the ingredient, because the post-diagnosis still the same. Then she brought in the report. I read the report one by one. What? Thyroid functions normal, because we know thyroid affects the period as well. When I keep reading, everything's normal. But she done a hormone test, that's normal. She done a skin for lining. Now we mentioned that when your ovulation, you need to have a lining of 8 mm or 9 mm, right? To be able to conceive. If there is no implantation, no conceive, then the lining fall and become period, right? That's in 14 days that your lining will be the thickness of the lining will be 8 mm or 9 mm. But this patient hasn't been for any period, no period for 3 months. The lining only 4 mm. So what does it tell you? For this patient is not coming for infertility. If this patient coming for infertility and say complain, the main complaint, I haven't got my period for 3 months. So what do? You check everything, and the doctor say normal. It's normal. The lining is normal too. The doctor says it's normal, and that's why the patient didn't know what happened. But for us, we look at that. 3 months no period and your lining still 4 mm, that's abnormal. That's definitely abnormal. What does it indicate? The lining is built from the blood. Not enough blood to build the lining. That's it. That is the diagnosis. That is one of the reasons, because we don't know the others here. Why do I say that we don't know the others? Of course, I know when I take the poll, that is the liver and gallbladder. Right? This is part of the reason. And the second reason is what? A lining. That's a lining linked to that. Yes, they're linked together. They're linked together. Okay. Okay. Keep digging. Is it the lining, the leg of blood, the quantity of blood, so hasn't got enough blood to build a lining? Is it because bleeding too much, that lack of blood? No, there's no bleeding for this patient. Is this because the intake of food quality? You need to have a good nutrient to turn to blood. So we need to check your diet. Seems diet's good. And I asked her to actually go for plant-based in the very first week. And she did on plant-based. Now you may think, why plant-based? Plant-based will get you low blood. That's not true. Because this patient eventually get period with plant-based diet. Right? With plant-based diet. If she was eating meat, didn't get her period. Now she get plant-based, she got period. Right, you see the difference? Okay. Now, this patient actually, the diagnosis. We're gonna find out why lining is so thin. So I said, well, according to Chinese medicine, that is because the diagnosis of wood in liver and gallbladder excess, right? So we treat that as okay, but I want to find out whether there's any iron issues. So lining 4 mm, and I keep checking, but I can't see ferritin and iron test. There is no ferritin and iron test. And how could the doctor, the GP, say everything's normal? No, you haven't run the proper test yet. There is no iron test, there is no ferritin test. How could you say this is normal? The test is normal, you haven't get all the tests done yet. And of course, if the ferritin and iron is low, then we know we need to build up your iron to make more blood to build up the lining. Then you won't have your period. Not for this case. And I say, well, you need ferritin and iron test. I need to know how well is your iron doing. So I write it down for her. I say, well, she said, what is there any other potential issue will cause this period stop? I said, well, according to Chinese medicine, is this blah, 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 about the liver. Explain to her. And I say, well, the iron is important too. Say we need to find the iron. Then further on, because I treat infertility patients a lot, so we always go for liver function and kidney function as well. I say you hasn't got liver function and kidney function test out. I would suggest you take the liver and kidney function as well, the blood test. I want to know that, so I write it down. But unfortunately, in New Zealand, we can't order any test for our patient. They have to go back to GP and ask the GP to prescribe the test, and then they bring the prescription to the lab and to get the test done. Okay. So Sam Herb, and you know what? And the third visit, so second visit, Sam Herb. The third visit, he said everything kept the same, no period yet. I took the pulse, He said, okay, keep going with the same herbs, no change. It's better, the pulse a bit better, okay, but not yet. Keep taking it. And she said, well, let's say if, and she forgot to get to the doctor and get the iron tested. I said, don't worry. I said, what can I do in my food, apart from plant-based? I said, well, you can eat more spinach or cerevit, all this food, and they may give you more iron if there is iron issues, lack of iron that causing the lining thin lining. And after 3 days, the third visit, after 3 days, after the third visit, and she texted me. She said, I got my period last night before I went to bed. You see, which means in 2.5 weeks, within 2.5 weeks or 3 weeks, then we actually build the lining thicker, and that is normal. So that we get the patient emotional stable. I was anxious, make the anxious go away through the herbs. She's not sleeping until the morning, 4 or 6 o'clock. No sleeping. How could you build your blood? You heal when you sleep. So we get her to sleep properly and build blood. Cold means circulation is slow. Very cold. Not enough energy in the body. So herbs in, energy arrive. Lift the energy up. So more energy, sleeping better, more energy, no emotional, no anxious. That's it. And period come. So if this is a infertility case, this is what we do as well. Same thing. It's no different. We bring the period come, and they will get pregnant. So this is a case that I need to share with you, although it's not a fertility case, but it's talking about the period is actually stopped, it hasn't been coming. So you need to get the period regular. Does it make sense to you? Okay. So according to your diagnosis, you make your diagnosis and you give herbs, you give acupuncture, no problem at all. Okay, then you suggest plant-based, and you need to have a knowledge why plant-based. There's a fertility diet talking about plant-based diet books, and the China study talking about the plant-based, how it helps your overall health. Okay, those are important, very, very important. So I hope you read those books that I just mentioned. Okay, this is a case study. All right, I hope that helped. Now, if you're patient, our clinic is in Dinsdale, Hamilton. We specialize in infertility treatment, male and female, and we have clinic in Dinsdale, Hamilton, in Cambridge, and Auckland. So you're welcome to join us for treatment. We have a pre-assessment. If you want, if you're not sure what we can help you, call us. We'll book you a pre-assessment. After 15 minutes, that's free. Then you need to fill in a form. Then we'll look at you and see whether we can find anything wrong, anything, any diagnosis, any dysfunction in the organs according to Chinese medicine, and we'll book you an initial examination to come in for initial examination. In the initial examination, we will go through everything and make a diagnosis and set up a goal and plan, and let you know how much it's going to cost you, something like that, and we start the treatment. Does that make sense to you guys? Now, if you're an acupuncturist, you know what I'm talking about today, right? This is sharing a case, tell that how important is the blood, how important is the lining, and how important is Western medicine testing. The test, everyone can use it, not just Western medicine. We use it. We use the test. We use the test to tell whether there's any abnormal, and we use the test to measure the Chinese medicine working or not. Okay, this is important, so I hope you get something out of it. Does it make sense to you? Do you learn anything today? Do you learn something today? Yeah, interesting case. The lifestyle is important. No matter what coming to you, what case coming to you, infertility or things like that, if they're anxious, you want to bring the anxious down. If they're insomnia, they can't sleep, you want to make them sleep, because sleep can heal a lot of things, right? If not eating well, you want them to eat well. Does it make sense? Right. That's it for today. It's an extra live video, extra topic live video that is not actually related to infertility, right? But we use this case to talk about infertility. It's a recent case that's in my mind, so I have the memory. And the other case, if there's, fertility case in some of them are not pregnant yet, so they're still under treatment. So no point to talk about those at the moment. Yes, I learned something from this case. Thank you, Suna. Have a great day. Thank you, Veronica. Thank you. Okay, that's great. As long as you guys get something out of it, and I love to share. Okay. Thank you very much, and have a good day, and stay awesome, everyone. Which is the best acupuncture method you have for treating infertility? Do you use the balance method by Dr. Tan Sumu Muksa? I use a combination. There is no best acupuncture method. Okay, Dr. Tan's method treating infertility is a good thing, good to use, and I use acupuncture spirit a lot. And when a patient comes with a structural problem, with pain, and I add on GE acupuncture and moxibustion, yes, but I don't use it often unless it's needed. What else? Russian, scalp acupuncture, navel acupuncture. There's another 2 acupuncture that I combine in infertility treatment. But again, there is no best acupuncture method. Okay, a lot of people want to ask me the best. There's no best. I do a combination. And acupuncture is just one of the method, one of the way to treat. Okay, and you must is fertility is a lifestyle thing. Change the dietary, change the lifestyle, and every disease is the same. Okay, don't put too much focus on just acupuncture. Acupuncture is just one of the way in my combination treatment, fertility treatment. We talk about emotional. We talk about dietary change, lifestyle change. You know, all those things need to combine together. You can't just treat infertility with acupuncture and don't care for other things. Does it make sense to you? Solo. Thank you, Martin. Thank you very much. See you next time. Thank you for your question.